Imagine it's 2016. A team of researchers at Stanford University trains an artificial intelligence on about 130,000 photos of skin lesions.
Which is just a massive data set.
Right, it's huge. And a few days later, they test this AI against 21 board-certified dermatologists. The task is just to distinguish between benign spots and malignant skin cancer.
And I'm guessing the AI did pretty well against them.
It didn't just almost match them, it matched them perfectly. It actually beat the doctors on several metrics.
Wow.
Yeah, decades of medical residency matched by a machine looking at photographs for a few days. So today on this deep dive, our mission is to uncover exactly how AI is reshaping healthcare. We're getting into the unprecedented breakthroughs, but also, it's really dangerous blind spots.
Yeah.
Because medical diagnosis is essentially this high-stakes game of pattern recognition, right?
It really is, yeah. That's a great way to put it.
So how exactly are deep learning systems suddenly outperforming decades of human clinical experience?
Well, it comes down to how these systems actually process information. Like, a human radiologist looks for the specific shadows indicating a tumor, or a dermatologist looks for a jagged edge on a mole.
Right, the visual cues.
Exactly. But deep learning algorithms don't just see a picture. They see millions of mathematical data points. They map every single pixel's color gradient and compare it to 100,000 other images, basically simultaneously.
Which a human brain just cannot do.
No, not at all. They are engineered to excel at finding exact visual and mathematical patterns. So they're doing what doctors already try to do, just at this microscopic computational scale.
And it's not just about diagnosing what's already there. I mean, this pattern recognition is actually helping us build entirely new cures.
Oh, absolutely. Look at Google and DeepMind. They built systems that can detect 50 different eye diseases with 94% accuracy.
50 diseases?
Yeah, 50. And they do it from optical coherence tomography scans, which are basically just highly detailed 3D maps of the back of the eye.
That is wild.
It gets crazier. We see that same computational power cracking the protein folding problem with AlphaFold 2.
Oh, right. The protein folding breakthrough. That was a huge deal in 2020.
Huge. For 50 years, the scientific community struggled to understand how proteins twist into complex 3D shapes. Because, proteins fold based on these incredibly complex rules of physics.
Right.
But AlphaFold 2 didn't actually learn the physics. It just memorized billions of structural patterns to accurately guess the final shape.
So it just bypassed the physics entirely.
Exactly. And by predicting these shapes, it rapidly accelerated drug discovery for conditions like malaria and Parkinson's disease.
Okay, but wait. If an AI can just bypass the physics and memorize the patterns, why am I still going to a human doctor? I mean, I read that a company called In Silico Medicine used this technology to design a lung disease drug candidate in just 46 days.
Yeah, and for roughly $2 million.
Right. Normally, that takes a decade and costs over $1 billion. If the math says AI is this much faster and cheaper, it sounds like human specialists are the bottleneck. Shouldn't they become completely obsolete?
Well, finding a pattern in a static photograph or a controlled lab database is vastly different from tracking a deteriorating patient,
Oh, so?
Because a real person has conflicting symptoms across a messy, multi-year medical record. When AI moves from a pristine testing environment into an actual hospital, things break down.
Oh, so the real world is too chaotic.
Exactly. Look at the 2017 failure of IBM Watson for oncology. It was designed to analyze medical records and recommend cancer treatments.
And did it work?
No. Doctors at several hospitals quickly realized its recommendations were actively dangerous.
Wow, really? Dangerous.
Yeah, internal documents later revealed the system hadn't been trained on real, messy patient data. It was trained on a small number of hypothetical textbook cases.
So it was just theory.
Right. It simply couldn't handle the complexities of a real human being with overlapping health issues.
It's like a teenager perfectly passing the written driving test in a quiet classroom. But the second you drop them into unpredictable, gridlocked, rush hour traffic, they instantly crash.
That is a perfect analogy.
Mm-hmm.
The real world doesn't look like a benchmark test. Take equity issues, for example. A skin cancer AI trained mostly on images of white patients routinely fails when diagnosing dark-skinned patients.
Oh, wow, that is a huge problem.
It is. Or look at algorithms designed to predict sepsis, which is a life-threatening bodily response to infection. It might work fine using data from American hospitals.
But it fails elsewhere.
Completely. When deployed globally, where patient populations and clinical practices are fundamentally different, it totally fails. The algorithm's underlying math just falls apart outside its bubble.
So if you're the one sitting in a hospital gown waiting for test results, what does this actually mean for your care? I mean, it sounds like AI isn't showing up to replace your doctor.
No, not at all. It's becoming your doctor's most vital partner.
A partner, right?
Because the future of healthcare relies entirely on human wisdom governing machine capability. We are already seeing this partnership extend critical diagnostic care to resource-scarce populations in India, Africa, and Southeast Asia.
Places where specialist physicians are desperately scarce.
Exactly. The algorithm handles the heavy computational lifting, but human judgment is required to apply it safely.
Which brings us right back to those 21 dermatologists from the 2016 Stanford study. They weren't replaced.
No, they were handed a powerful new tool.
But it does leave you with a pretty provocative thought to mull over before your next checkup. As these machines get even smarter and more highly validated, if a machine and your trusted human doctor completely